Welcome everybody to our webinar here at Maine Health Management Coalition called What Now? Guidelines for Cancer Survivorship After Treatment. Just a little bit about the Maine Health Management Coalition. We're a purchaser-led organization and we work to improve health and maximize the value of healthcare services in Maine. And we have over 70 members made up of health plans and brokers, providers, affiliates, consumers, and purchasers. And we want to make sure that we point out our annual symposium coming up in 2 weeks on October 27th, 2016, and encourage you to sign up for it. We have a wonderful keynote speaker, David Blumenthal, coming from the Commonwealth Club, and lots of really good breakout sessions, and it's going to be a great day. We really encourage you to join us. And then what you can do here at Maine Health Management Coalition is be part of identifying best practices in Maine about health care, accessing custom analytics. We have a great opportunity for networking. We really welcome folks to influence change and to participate in our membership, education, and networking events like today. And we want to point out our upcoming webinar called Cancer Prevention in the Workplace, coming on November 3rd from 12 to 1. Before I introduce our presenter today, I just want to encourage you to write your questions in the chat box online. We'll be leaving some time at the end for questions and answers. So type them in at any time and we'll make sure to get them asked at the end. Our esteemed presenter today is Dr. Neil Maniar. He's the Vice President of Health Systems of the American Cancer Society's New England Division, which serves communities in Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, and Vermont. As the division's health system leader, Neil leads a team of more than 40 staff to work with state-based hospital and primary care health systems to further the Society's mission to save lives from cancer. His team works within healthcare systems to increase utilization of cancer, prevention strategies, and cancer screening tests. To reduce barriers to care for cancer patients and to engage healthcare organizations in fighting cancer through the Society's advocacy, and to engage healthcare organizations in fighting cancer through the Society's advocacy, corporate, community, and fundraising initiatives. Neil also serves on the senior leadership team, which comprises the New England Division's senior-most staff. Neil received his PhD from Johns Hopkins University, Bloomingburg School of Public Health in 2005. In 1998, he earned his Master's in Public Health with distinction from the Yale University School of Public Health. And in 1994, he received his bachelor's degree from Connecticut College with a double major in English and zoology. Welcome, Dr. Maniar. We'll have you take it away.
Great. So thank you for the opportunity to speak with you this afternoon about survivorship guidelines and importantly about the issue of cancer survivorship and not just what survivorship means from a clinical perspective, but what cancer survivorship means from the perspective of individuals and families and caregivers and the multitude of challenges that often accompany survivorship and that period of survivorship, and how important it is for clinicians and care providers to help patients navigate through that journey. So I'll talk a little bit about just what we mean by survivorship when we talk about this term. I mean, it's a term that we use very often in so many different contexts. And historically, cancer survivorship has really been about that period that's about 5 years after diagnosis. But this has really evolved over time. And it really now is a term that begins at the moment after diagnosis. And it has also expanded to include not just the patient, but also the family and caregivers and all of those individuals that play such an important role in the cancer journey and that are also profoundly impacted by the cancer diagnosis. So while this term often means time after active treatment, the NCI defines survivorship as the health and life of a person with cancer post-treatment until the end of life. And it not only covers physical health, but also includes psychosocial and economic issues related to cancer, both beyond the diagnosis and treatment phases. So I'm sure many of us have seen firsthand the tremendous impact that a cancer diagnosis has, and how going through cancer treatment can have an impact not just on the mental and physical health of an individual, but it has economic impacts. It can influence job stability, housing stability. It has an impact on nutritional status of the patient, and it also has an impact on family members and others that are around that cancer patient and helping that individual through the cancer journey. It imposes a significant amount of stress, and that stress is not often immediately relieved when treatment ends. So in addition to kind of thinking about this broader definition of survivorship, it's also important to think about the fact that there are some cancer patients, and probably a good number of cancer patients, who don't like the term survivor. For them, cancer is not a defining part of their life. For others, the term cancer survivor doesn't really fully capture their own experience. People may rather use the term that refer to their journey post treatment as the period where they're thriving, where they have successfully fought cancer and won. So this idea that the survivor experience is very different from one individual to the next. So how we talk about survivorship, how we use this term, it's really important to think about the context that individuals may be in and their own perspectives. Broadly, as we talk about survivorship this afternoon, we're really going to look at that period immediately after diagnosis and really think about all of the different aspects of health. And again, when we talk about health, we're talking broadly about health, so mental, physical, psychosocial, economic health of individuals, and how do we make sure that we have the appropriate guidelines and the appropriate strategies to support that broader constellation of health for individuals and their families and caregivers. So the number of survivors is expected to dramatically increase for both males and females over the next 10 years. It is expected that overall there are going to be nearly 19 million cancer survivors in the United States by the year 2024. Certainly this is partly a function of an aging population, and it's also partly a function of our improved ability to treat cancer, our improved ability to tackle cancers that were once thought of as untreatable. So our scientific advances, our research advances, our clinical advances are leading to a greater number of cancer survivors, which is a wonderful thing. But as a part of this, that also means that there is an increased need to make sure that we have the appropriate strategies and tools and resources available, both in clinical and non-clinical settings, to address the broad constellation of needs that cancer survivors may have. For males, as one would expect, a good number of the cancer survivors, both currently and in the future, are survivors of prostate cancer. We also see that there are more and more cancer survivors for colorectal cancer, for melanoma. As we look at this list, both the current list and what we expect in the next decade, we notice that there are some cancers on here that there are some cancers that are not on this list, that we know there's an increasing incidence of those cancers, whether it's liver cancer, pancreatic cancer, often what we term the recalcitrant cancers. So when we think about this idea of cancer survivors as those individuals who are surviving cancer from the moment of diagnosis, it's also important to keep in mind the exact type of diagnosis that a cancer patient may have and what that means in terms of prognosis. But clearly, over the next 10 years, for males and also for females, we're going to see a significant increase in cancer survivors. For females, breast cancer diagnoses certainly make up a significant percentage of cancer survivors. There's expected that colorectal cancer our number of survivors from colorectal cancer will hopefully grow by the year 2024. And part of that is our increased focus on prevention and early detection, particularly with respect to colorectal cancer. We have the ability to detect colorectal cancer early, to treat it in an early stage, and therefore to increase the likelihood that an individual will become a long-term cancer survivor from that diagnosis. So as we look at survivorship, it's important to not only look at cancer survivorship in terms of gender and site, but also think about it in terms of time since diagnosis. About 2/3 of all cancer survivors were diagnosed 5 years ago, or 5 years or more. About 15% were diagnosed over 20 years ago, which is amazing. That's an amazing statistic. 15% of survivors have been living over 2 decades since their initial cancer diagnosis. About half of the cancer survivors are 70 years or older. Only about 5% are younger than 40 years. So what it means is that when we think about cancer survivorship, we're often thinking about an older population and one that's also at risk for other both cancer and non-cancer related comorbidities. So this, again, brings us back to the idea of the importance of having clinical guidelines with respect to some of these cancer areas to make sure that both patients and providers are equipped with the right strategies and the right questions when thinking about survivorship care. From the perspective of the American Cancer Society, survivorship is a really important area. Our focus is to really make sure that we do everything that we can to focus on prevention and early detection once patients are diagnosed with cancer, to do everything we can to make sure that they have access to the resources needed to successfully go through the cancer journey. And survivorship is an important component of this cancer journey to make sure that once their treatment ends, that we are able to connect them with the resources and answer the questions and help them with the types of education that they might need to thrive during that period of survivorship. Survivorship is also a strong focus area of the Institute of Medicine. So the development of the guidelines was something that was strongly supported by the IOM, and it came through a series of recommendations that they had put forth. Importantly, when we look at one of these recommendations, they really emphasize the importance of having evidence-based clinical practice guidelines. In the context of survivorship, this is very important. We want to make sure that we build upon what we already know and what works, and make sure that both the guidelines and the tools and the instruments used to advance survivorship are ones that are evidence-based. And importantly, ones that are developed through both a public and private sector collaboration. The IOM also wanted to make sure that providers are equipped with the tools needed to help cancer survivors. And whether it's through educational opportunities, through other tools and strategies, making sure that providers are equipped with the right tools to help cancer survivors successfully thrive during that period, to help them navigate any comorbidities that might arise during the survivorship period. So through those two recommendations, the IOM came up with the recommendation that the team collaborates with patients, and this is really important, that patients are an important part of the guideline development process to really understand what is needed to reflect the patient needs and values, what is needed to make sure that there's a focus on psychosocial support across the cancer care continuum. The inclusion of some of these other realms of clinical care becomes very important when we think about cancer survivorship. And when we think about the impact that survivorship has, both the long-term impact and both the late effects of cancer treatment and a cancer diagnosis. As I'd mentioned earlier, a cancer diagnosis, it turns life upside down, and it has such a profound impact on so many facets of an individual's life, on so many facets of their family's life or the lives of their caregivers. And these aren't immediately resolved after treatment ends. Oftentimes there are lingering effects. There are lingering psychosocial effects from a cancer diagnosis or from cancer treatment. And making sure, so the guidelines are really about making sure that these other areas are addressed when thinking about the type of care that cancer survivors need. So when we look at the impact of cancer treatment, there are those impacts that are, that one would expect. The impact from radiation, from chemotherapy. Chemotherapy can impact everything from the ability to taste food, from the energy levels that individuals may have. Chemotherapy can have important physical and mental health impacts. But it also has important psychosocial impacts, the ability to be able to engage with others in the family or in the community. Then there are surgical side effects for those cancers where surgery is an option. And for some of these cancers, the surgery can be extremely difficult, and those side effects from that surgery can linger for many years, if not being permanent. There are side effects from hormonal therapy, and then there are non-treatment specific side effects. So again, the idea that a cancer diagnosis has such a broad range of impact on an individual, both clinical and non-clinical. And what this does is, at the individual level, it yields a number of different effects and potential risks. So, and these can sometimes linger long after treatment ends. So when we think about the types of needs that a cancer survivor might have, quality of life for a cancer survivor can be broken out into 4 different domains. And that when we think about the cancer treatment, the cancer diagnosis, it really does impact quality of life in each of these different domains. And this impact lasts well into the survivorship period. So when we look at physical well-being, things like functional status, fatigue, sleep, for some cancer survivors, still not being able to sleep long after treatment has ended, the overall physical health, health sometimes, returning to optimal health can be a process that can take several years for some cancer survivors. And for some survivors, there's never a return to full optimal health, or the type of health that the individual enjoyed prior to the cancer diagnosis. It can have an impact on fertility. It can have an impact. There's pain that may often linger after the diagnosis and treatment. Social well-being is one that is really important and sometimes difficult to capture in a clinical setting, depending on the types of questions that are asked by the provider, depending on the type of information that's given by the patient or the patient's caregiver. Family distress is something that is not uncommon for cancer survivors. Thinking about the stress that's associated during the period of cancer treatment, and the fact that some of that stress can last long after, and that stress is not confined to the patient. It can have an impact on other relationships with the family, and relationships beyond the family. Cancer treatment and the period of survivorship can have an impact on emotional affection, on sexual function, on appearance, and all of these things can be associated with increased levels of isolation. The financial burden of cancer survivorship can be very significant. I had mentioned earlier that job security is something that is often heavily impacted by cancer treatment. But it's not just job security. Cancer treatment can be very expensive. It can impose a significant financial burden on patients and families. So that's something that becomes important, and it becomes important when thinking about the types of resources and services that cancer survivors need. And again, not just the patient, but sometimes also the patient's family and other caregivers. Psychological well-being is another important dimension where quality of life can significantly be impacted. Depression is very common. The fear of cancer recurrence. And this is something that's really important in the context of survivorship. I've had several conversations with cancer survivors who have talked about the struggle, wanting to feel like you've beaten the cancer, but this constant fear that it's going to come back. For certain types of cancer diagnosis, there's a high likelihood that the cancer may come back in a few years, in 5 years. So what does that mean when you use the term survivor? What does it mean if you have a diagnosis where there's a high likelihood of recurrence, or even diagnoses where there's not a high likelihood of recurrence, but that fear that what if it does come back? What if it comes back in another form? And then spiritual well-being. Spirituality is something that can be very important for patients in terms of helping them get through the diagnosis, helping them get through the treatment. And it's something that can be much stronger post-treatment, but it could also be the opposite for some patients. What does the illness mean in the context of their own spirituality? What does it mean in the context of their feeling of hope or hopelessness, even though they have completed treatment? For those patients, again, thinking about this in the context of some of these other dimensions. And one of the important things here is that these domains are not mutually exclusive. What happens within one domain is likely to influence quality of life in another domain. Social well-being can be strongly influenced by psychological well-being and physical well-being, and similarly, spiritual well-being. But what this does do is it gives us a sense of all of those different dimensions of health and quality of life that we need to think about as we think about meeting the needs of cancer survivors. So the need for survivorship care is clearly underscored, both by the data, knowing that there's going to be an increased number of cancer survivors over the next decade, by our understanding of the many different ways in which different dimensions of health are influenced by a cancer diagnosis, by cancer treatment, by how the influence of treatment can linger long after treatment has ended. We also know that there are a number of unmet physical, psychosocial, practical, and spiritual needs for cancer survivors. When we think about what occurs in the clinical setting, there are important gaps. We also know that in the community setting, there are important gaps for patients, whether it's around nutrition or financial stability or around relationships that they have or feelings of isolation. The coordination of care and communication between primary care providers and oncologists is really important. We know it's a critical area of need for cancer survivors, and really the importance of making this coordination much more consistent. Right now, we know that there's some areas where that works well. There's some areas where it does not work well. And also, this is one area that is very much influenced by a patient's socioeconomic status and by how fragmented an individual's care might be. If a patient is receiving care in multiple settings, and those settings are not really designed in a way that they can coordinate with one another with respect to that patient's care, there's going to be a very low degree of communication that can then impact the overall care experience that the patient enjoys. And then there's this idea of the long-term and late effects. So long-term effects being those that manifest themselves during treatment and last well beyond treatment. So this could be continued fatigue, continued pain, loss of appetite, lack of sleep, lack of sexual function. And then late effects. What are those effects that may emerge a few months or years after treatment has ended, and how do we account for those in survivorship care? And then importantly, this idea that there's a high degree of complexity for care for some of these cancer patients, depending on the type of diagnosis, depending on the severity of the diagnosis and the complexity of the treatment that the patient received. And then the issue of comorbidities. I mentioned earlier that when we look at the data, knowing that roughly half of cancer survivors are age 70 and older, and that there's a high probability of other comorbid conditions, both cancer and non-cancer related comorbidities. So how do we account for those in survivorship care as well? So I mentioned just a little bit about the long-term and late effects, and this is important. As we think about cancer survivorship, it's important for us to really keep this in mind and think about how our survivorship strategies and tools and resources are designed to really be able to address and account for these long-term and late effects that have such an important impact on the lives of cancer survivors. So the guidelines that we're going to go through were the result of a collaborative process. This included the National Cancer Survivorship Resource Center, which was a collaboration between the American Cancer Society and George Washington University. And this center was established in 2010 through a 5-year cooperative agreement from the CDC. So the process used to develop these guidelines was a very scientific process, and it's a process that is often used by the American Cancer Society and other societies to develop these types of guidelines. And it includes both, having an expert work group, having an extensive literature search, really learning from the base of evidence that we have available to us, and making sure that it is reviewed on multiple levels by multiple stakeholders to ensure that the final guidelines really reflect not just the needs of cancer survivors, but also the very best scientific evidence that we have available to us to ensure that we are coming up with strategies that are going to be impactful. So this is just a little bit about the survivorship guidelines, and this isn't meant for you to be able to read the actual guidelines unless you have a magnifying glass in front of you. But what the American Cancer Society did through this collaborative process was come up with guidelines for 4 different cancer sites. So this includes breast cancer, colorectal cancer, head and neck cancer, and prostate cancer. And the breast cancer survivorship guidelines were released in collaboration with the American Society of Clinical Oncologists, ASCO. So I'll go through a little bit about these guidelines. So I talked about the disease areas that these guidelines covered, so breast, colorectal, prostate, and head and neck. In addition to that, there were other key areas that were covered by these survivorship care guidelines, and these tie back to some of the things that we had talked about earlier in this presentation. So really looking at surveillance for cancer recurrence, screening for other primary cancers, really thinking about the management of both physical and psychosocial long-term and late effects, which is really important. Looking at health promotion and care coordination. All of these domains are so important to ensuring that cancer survivors have the best chance for optimal health throughout their survivorship period. So in addition to some of the survivorship information, the National Comprehensive Cancer Network also has topic-based guidelines for survivors that cover things like anxiety and depression, cognitive function, exercise, fatigue, immunizations, infections, pain, sleep disorders. So all of those things that are so important in terms of quality of life and some of our typical area of focus from within a clinical setting. The American Cancer Society's disease-specific guidelines that I've mentioned These guidelines are really designed to be as holistic as possible and covering multiple domains. So it includes surveillance, screening, the long-term and late effects, health promotion. So again, making sure that we provide a tool that fills some of those important gaps that cancer survivors experience as they're going through their own care. So here you have, so this link, you can actually click on these links and it will connect you to the guidelines that we have for prostate cancer, for colorectal cancer, for breast cancer, and for head and neck cancer. And these are all available through cancer.org, so they're widely available and hopefully, should not be difficult for folks to access. And again, while these guidelines are really meant for clinicians, they're also meant for patients. These guidelines were designed to help empower patients as they are working with their care providers to address different areas of need. So you can, if you go to cancer.org/professionals, you'll be able to access all of these different care guidelines as well as other resources that we have available to help both patients and providers with survivorship care. And then we also have patient pages. So through this link, so these patient pages are a great resource for patients to be able to talk to their doctors about these guidelines and to talk to their doctors about issues that they may be experiencing. So as I mentioned earlier, these guidelines and the accompanying resources are meant to help both providers and their patients make the most and make sure that they can have the best care experience possible. So a couple of key takeaways in terms of survivorship and facts to know in case you find yourself on a Saturday evening with friends and you want to throw out some trivia questions. There are 14 million cancer survivors right now, but we know that by 2024 there will be many more, at least 19 million, if not more. The guidelines that we have right now, and these were the product of a very rigorous and scientific process, cover 4 major areas: breast, colon, head and neck, and prostate cancers. And the goal is to make sure that we provide we all experience the highest quality cancer survivorship. The COC standards are also an important reference point for us. We want to make sure that these guidelines help meet the COC standards for survivorship care plans and psychosocial distress screening, which has been challenging for cancer centers. But importantly, the incorporation of these guidelines is more than just checking the box. These guidelines are really designed to be something that will help healthcare systems build and develop high-quality survivorship care. And we're going to go into this in a little bit in terms of some of the other tools that we have. So I just want to quickly touch upon the COC standards that I just referenced. So there are 2 standards that are very specific to what we're talking about right now. There is a specific standard around psychosocial distress screening and making sure that cancer committees develop and implement processes that focus on psychosocial distress screening and referral for providing psychosocial care. And this is something that we know is incredibly important for cancer survivors, both the patients and their caregivers. And then this idea of having a survivorship care plan, making sure that the plan is as comprehensive as possible, and that the process has a degree of monitoring and evaluation built into it. So this graphic shows some of the key things that come into play when we talk about the application of these guidelines within a hospital setting. So we have the standards, we have our audience, and we have what we know about survivorship. So how would we use these in a hospital setting? So we have the content. So these guidelines are designed to be included in survivorship care plans. They can help influence clinical pathways and how clinical pathways are designed and implemented. And importantly, the guidelines can be an important tool for strategic planning. especially when thinking about designing these comprehensive survivorship care plans and processes, and ones that touch many different areas within a cancer center and the related services. So this idea of content, clinical application, and strategic approaches, these are all very much related. Again, these aren't mutually exclusive domains. This is really designed to be a feedback loop, essentially. So for the content, I've mentioned the COC standards, the care plan, and the survivorship guidelines, and making sure that there is a comprehensive care summary and a follow-up plan for patients with cancer who are completing their cancer treatment. And then importantly, I do want to highlight the fact that for the survivorship guidelines, the recommendations for surveillance and recurrence based on staging and treatment, again, really making sure that we have the data available to help us understand not just what cancer patients need, but what are the trends that we're seeing. And then thinking about both the physical and psychosocial late and chronic effects associated with cancer treatment. This is, I can't emphasize this piece enough, and I know many of us have seen this in the settings in which we work, and how that psychosocial element is so profound and so long-lasting for many cancer survivors. So for oncologists, there are a couple things that are really important and that they should know. So certainly I've mentioned the COC accreditation standards require survivorship care plans, and they require patients to be screened for distress and psychosocial health needs. These guidelines are available to help guide the content of these survivorship care plans for certain areas of cancer, and these are all widely available to everyone via cancer.org. So just quickly, talk a little bit about some of the clinical applications of these guidelines. So for clinic visits, these guidelines can be really important in terms of follow-up visits, focusing on survivorship and survivors. There are provider checklists that are available for the different areas of cancer that I had mentioned, but also for the different components of survivorship care for other cancers, and this is what we had talked about in an earlier slide. And then for the clinical pathways, really thinking about how we can design clinical processes that effectively manage both assessment and quality processes related to all of those different components of survivorship care. Okay, so in the interest of time, I'm going to just skip over that example. But for I do want to make sure that we focus on the strategic planning piece. Strategic planning is something that a good strategic plan or good strategic planning process is one that's really facilitated by the right tools and the right information to help guide the development of those strategies. And for strategic planning in the context of survivorship care, the hope is that these guidelines will help provide some of those tools and that information that's really necessary to build a survivorship care plan that addresses all of those different components of clinical and non-clinical care. So again, the guidelines and the toolkit, the goal is that they'll provide cancer centers with the evidence-based recommendations that are needed to develop these comprehensive care strategies, and importantly, to address the growing needs. And we know that we're going to continually learn from this process. As the population of cancer survivors grows, we will get a better understanding of how their needs change. And those needs will also change based on the changing healthcare landscape. And for us, as providers, as organizations who are dedicated to helping cancer survivors, it's really incumbent upon us to make sure that we are able to keep our finger on the pulse of how those needs are changing and making sure that we're able to adapt to address those needs. So I'll end by just quickly reviewing some of the tools and resources that we do have available. And feel free to reach out to any of us at the American Cancer Society if you if you have any trouble accessing any of these tools and resources, or if you would like to get access for those that might not be available via cancer.org. So I'm just going to focus on a couple of key areas here. Social media. We have readily available slides to help talk about these guidelines, to help talk about survivorship. There's actually a really cool app that has been developed. And then there's also a dissemination toolkit. So for email and social media, we actually have text that we can tailor for hospitals. And we can work with hospitals to provide that tailored text to talk about these guidelines and talk about how this is relevant in terms of COC standards and other resources. We also have social media. For social media, we have different strategies and best practices that are available. And this leverages Twitter, Facebook, LinkedIn, Google. And again, as thinking about how not just the healthcare landscape changes, but how other areas change as well, for us it's going to be important to make sure that we are adapting as different trends change within social media. I was just informed by my younger cousin that only old people now use Facebook, which is great for us in terms of cancer survivors, as we know that there's an increasing population of people over 50 who are getting onto Facebook. So that may be a good place for us to leverage social media to talk about survivorship. We also have other presentations that are available, including overviews of survivorship, the need for survivorship care, how these guidelines were developed, and the content and specifications within these guidelines. So we're happy to make these available to you as you advance survivorship goals within your own institution. And we have provider tools. We have an app that is now available on iTunes, and it's actually going to be available on Android soon. And then we also have an e-learning series. So this is the e-learning series is not just for primary care. It's anyone who is delivering survivorship clinical care in any number of different settings. So here's just a quick screenshot of what the clinician mobile app looks like. And you can click on these links to access it. And then here's a link to access the e-learning series that I just referenced. And the e-learning series covers a series of different modules. So including what is the current state of care, when we think about late effects and its treatments, what do we need to do in terms of managing those comorbidities? What about the psychosocial health in terms of late effects of cancer and treatment? There are modules that talk about care coordination for survivorship care, recovery and rehabilitation associated with cancer. And then specific modules talking about those different areas of cancer where we do have specific guidelines available. And here's just a quick link to the dissemination toolkit. So here's some links to the partners that I had mentioned earlier and some other resources. Certainly want to thank our partners who helped us in the development of these guidelines, and wanted to thank all of you for taking the time. So I think we have some time for questions and hopefully answers as well, or it could just be questions.
Thank you so much, Dr. Maniar. That was excellent. I'm really aware now of the complexity of this whole issue. It's for as many survivors, it seems there are as many individual needs and responses necessary, which I didn't know. It also strikes me, too, in listening to you, that there's going to be sort of a tsunami of needs and support required for the increasing population that's growing that are going to be survivors. So all really, really interesting to think about. I've got 4 or 5 questions, and I'd encourage you, those that listened, there's still time to write a question in the chat section if you have any. The first question that I have for you is, in your experience working with long-term survivors, what are some of the greatest unmet needs you have witnessed, and how can we address them?
That's a great question. I think there are probably 2 or 3 different domains of needs that really come up for cancer survivors. And when I've talked to cancer survivors and worked with cancer survivors, it's very clear that some of these domains are very, very significant. So the first is just the level of anxiety and the level of stress that is associated both with the diagnosis of cancer, with treatment and managing the complex logistics associated with treatment, and then once treatment ends, trying to figure out how to piece life back together after cancer treatment has ended. What does it mean for some cancer survivors? They may have lost their job. I've spoken to cancer survivors who've had to sell their house in order to pay for either their own cancer treatment or the cancer treatment of a family member or loved one. So trying to figure out how do you start to piece things back together, and the level of anxiety that's associated with that, and this feeling of almost sometimes helplessness, because there's so many different things that they're trying to figure out at the same time. So how do you tackle that, and who's there to help you to do that? Because you might not be able to talk to your primary care provider about the stress of losing a job, or even if you do, what is the primary care provider, what is their own capacity to be able to help with that? So that anxiety and stress is a really significant area of need, and it touches many different areas. I think another major area of need is just around nutrition and overall health status. So there's a lot of research that has been coming out in terms of the nutritional status of cancer survivors, and this is something that is certainly a function of socioeconomic status, and we certainly see in certain populations, and particularly underserved populations, where this is very challenging, and it's certainly not independent of the financial stressors that individuals may be experiencing. And then there's the third domain is just around relationships and that feeling of isolation and that feeling of being connected. This, for cancer survivors, and especially those that are have just completed their treatment, they've just gone through an incredibly profound and stressful experience, and a life-changing experience, and that can result in lingering effects. They may not have the energy to go out. They may not have the energy to engage in relationships in the way that they were able to prior to treatment and diagnosis. So what does this mean in terms of their day-to-day life, their quality of life, in terms of their mental and emotional and physical health? So those are some of the key things that have really come out. It's just, and I think all of this is really tied to this fact that once you're diagnosed with cancer, the focus is on treatment. While you're getting treated, the focus is on, what do I need to do to make sure that I can get through the treatment? So it's only really when that treatment ends that suddenly it's like, wow, what next? What do I do now? And so that ability to be able to plan for that, and either for the patient and their family and caregivers to be able to plan for that, or for providers to be able to provide them with that plan. So this is what we're going to do now. This is how we're going to help you through this next phase of your journey, which hopefully will be a very long and healthy phase, which is that period of survivorship. But those are some of the key things, and that probably only scratches the surface of what cancer survivors experience. Again, this is so much of this is a function of the type of cancer an individual may have been diagnosed with, the stage and the severity and the complexity of their treatment, and for some people, they may be able to snap right back and return to life just as it was prior to diagnosis, and for others, it could be a very different situation.
Thank you for that answer. That was wonderful. It takes me to not the next question in line, but to one that feels connected, which is, what is your sense of how the behavioral health community has responded to the amount of survivors that are coming down the lane?
That's a great question. I think there's some really good work that is taking place. I think there's a lot of room to make significant progress in this area. When we think about mental and behavioral health, particularly thinking about how to increase coordination between primary care and mental health providers, between other behavioral health providers, when we think about not just the diagnosis of need, but how we're able to address those needs, there's a lot that we can do. I think there's we still need to have a larger conversation and more focus on the mental health needs of cancer patients and cancer survivors and their caregivers. I'm sure many of us have witnessed firsthand, when we talk about the stress of a cancer diagnosis, it's not just the stress. It's the depression and anxiety and all of those other things that are associated with the diagnosis, and those don't always go away after treatment has ended. And for some patients, that depression can linger long after, and it can linger not just for the patient, but for their caregivers. The changes in relationships, the changes in other areas, or the impact on quality of life in other areas can have a significant impact on mental and behavioral health. And I think there's more that we need to do to really integrate that better with survivorship care.
Excellent, thank you. When cancer patients return back to primary care for medical management, what do you find is the largest disconnect between the oncology team and the primary care professional?
That's a really good question. I think in the near term, what I've seen is that there's often a good degree of communication if the services themselves are coordinated. So, say a patient receives oncology care in a certain hospital, and their primary care is within that same facility, there's probably a greater likelihood that there's going to be a lot of communication and coordination between the two, and the right needs are being identified and addressed. What we see now, though, is that it's not uncommon for patients to travel for their oncology care so that their primary care is in a very different setting. And they may have systems that don't really talk with one another, so it really becomes the responsibility of the patient to be able to advocate for themselves and to be able to communicate information to their primary care providers or to their oncologist. And I think that's probably the biggest disconnect right now, is where you have different systems of care, patients that are receiving care through different systems. How do we create better ways to coordinate their care? How do we make sure that we're really thinking longer term in terms of survivorship and thinking about the other cancer and non-cancer related comorbidities that patients may experience, and then also thinking about all of these other psychosocial factors, thinking about the fear and anxiety associated with possible cancer recurrence, all of those things that we would hope that cancer patients are able to communicate, or cancer survivors are able to communicate to their primary care providers, but you may not. And there's so many barriers that could impact that, whether it's language barriers, health literacy, other barriers. So I think there's much more that we can do to increase the coordination, to streamline the processes, to make it more focused and more efficient, so that primary care providers are really able to ensure that patients have the level of survivorship care that they need. And that's really what these guidelines are designed to do. They're really designed to empower both patients and providers to help facilitate that.
Excellent, thank you. It strikes me, as you're speaking, that there must be a huge sort of moment of truth there after the fight of the treatment end and the beginning of the transition to the rest of your life happens. Do you find that that's a critical moment in terms of sort of prevention of some of these other secondary issues?
Absolutely. I think that is perhaps one of the most important moments, and that's where the importance of having a survivorship care plan that really includes all of these different dimensions becomes so important. For some patients, and I would probably venture to guess for many patients, it's really going out into the great unknown. Even though you may be going back to the very same life that you had prior to diagnosis and treatment, everything can be totally different now because of that life-changing experience of the cancer diagnosis. And the ability to really understand that there are resources, that there are services available to help navigate through some of those questions, to navigate through that unknown, can really play a significant role in helping to prevent anxiety and depression, isolation, making sure if there's a way to essentially screen for the likelihood of some of those things occurring once a patient is completing or has completed treatment. If there's a way to anticipate that and to be able to address it early on, it can be really important. And we know that there are certainly certain risk factors. We know that social isolation is much more likely among the elderly population. So if we look at the data of cancer survivors, and we see that a very significant percentage of cancer survivors are 70 and older, it's a pretty safe guess that social isolation is going to be a potential risk factor for those patients. So how can we connect them to community organizations and other community services that are there to help tackle isolation? Similarly for anxiety and depression, if we know that depression is more likely for certain groups of cancer survivors, can we make sure that we address that as a part of the cancer plan? I think that it's probably one of the most important moments to prevent some of these things that might occur during the period of survivorship.
And our last question, I think, for the hour is, how do you suggest we engage allied professionals that may be outside of traditional primary care, such as mental health providers, spiritual and religious organizations, and fitness centers?
Another great question. I think the most important way to engage allied health providers is to make them visualize and understand their role in helping cancer survivors and their role as a part of this larger care team that cancer survivors need and that hopefully they have. So for these allied health professionals, or for kind of these non-clinical providers of care, and I love the fact that fitness centers were mentioned in that, and spiritual providers, they all address different dimensions of health. And I think one of the important things for all of us is when we talk about health, are we taking a narrow approach to health and only talking about health in terms of physical health, or are we talking about it more broadly in terms of mental and emotional and financial and spiritual health? And when we take that broader definition of health, it really brings more people under the umbrella of kind of healthcare provider, and more people under that larger umbrella of all of those individuals and services that are not just responsible, but that have the opportunity to maintain the health of an individual. And I think that's where it becomes really important that we change, or not that we let our own conversation evolve so that we are incorporating that broader definition of health.
Excellent. Well, I want to thank everyone for attending today, and thank you so much, Dr. Maniar, again, for this amazing information. And I want to remind folks that we'll have a recording of this webinar today, as well as the slides available on the Maine Health Management Coalition website. So thank you, and take care.
Great. Thank you, everyone.
Thank you.